I would support what you're saying totally. I know I'm on the insurance committee also, and when a bill to reform the auto insurance, auto no-fault insurance was before our committee, somebody organized just, tons of people in wheelchairs who've been in accidents and who were able to function because of the care they were able to get. It made it a very emotional impact. And if you can do that, now, that was a bill that was up for a vote, and this one isn't. Ours is not. But you could still go to people's offices. And so I would encourage you to do that. I mean, like you said, the visual makes an impact. And you're right about the, education. You have to be able to afford to buy the fruits and vegetables, and and many people, not only can they not afford them, but if they don't have a car and can't walk to and have to walk, then they're relying on the convenience stores that don't even have fruits and vegetables or meat.
We thank you, Representative Wright, for your response to that. But I wouldn't dare speak for Mr. Churchwell, but I think in some of that he was referring to our legislators and the people that we've elected to help us get to connect the dots. And in doing so, if these people, some of those people that you deal with on a daily basis, if they could see what was going on in our communities, and I can respect what Senator Hansen, what he said about the urban agenda, this will help us, and I hope that he will keep us informed as to what's going on, and some of us can make ourselves available so that we can go over and address some of these issues. At this time, we do have, and I'd like to give him a few moments. We have Representative Bill Heisinger's director, and I wondered if this is Mr. Greg Van Workum. I'd like to know if you wanted to share anything, or if there's something that was said today that you will be taking back to Congressman Heisinger on our behalf.
Yeah, I had a quick question. One of the reasons why it wasn't taken was does not follow federal guidelines. Which guidelines was that?
That came from Representative Wright as to some of the reasons. It says the first one was bill does not follow federal guidelines.
That was from Representative Hayes.
Yeah, well, I was saying that was in my report from you.
I guess it was part of my comments asking for Congressman Heisinger.
I think it came from some initial meetings, and it was talking about the national fire and safety and what was required and about it not being life-threatening, etc. And so I would venture to say that it's definitely tied into that particular piece of it, because they were talking about the reason it wasn't didn't have a lot of muster was because it was not having the generators, and for people having to return, etc. is not life-threatening, although inconvenient.
That's right.
So to answer that, I would have to venture to say that has a direct correlation to what they're sharing when they're talking about federal guidelines.
Okay.
Yeah.
So it's more like building code stuff then?
A similarity, because again, the buzzword was not non-life-threatening. That was really the buzzword, because the whole gist was about the generator itself, and the quote-unquote problems that it could solve to alleviate people having to return, and to alleviate them having to self prepare as far as the cleansing of the blood, et cetera, and then it happened to be brought up about I think the fire and safety codes and those kind of things, and about the codes that were there as related to health and the kind of things that were required in hospitals and several facilities, et cetera. And then that's when they started being thrown around about Is there, one reason is it's not quote unquote feasible,
It's
is
not
because it's a
It's not
non-life-threatening
that.
situation.
It's not that a federal government is saying this bill doesn't fit.
No.
It's just an extra
No.
thing
Yes.
that is not
Right.
a
Yes.
part
Right.
of it.
It's not part of the medical.
Medicaid, Medicare doesn't require it.
Right.
Excuse me, Brother,
Medicaid and Medicare don't require
And don't see it as life-threatening.
a generator.
Right. But you could still put them on. There's nothing in the federal government saying
Right.
you can't
Right.
do this.
Right.
Right.
but are they not
Something
governed by
like
the National Fire Protection Agency?
Yes,
Those, they follow under those guidelines, the
Yes.
life safety codes.
yes.
And once a patient goes on dialysis, they can be sick in renal failure for years. But once the patient goes on dialysis, they automatically, the federal insurance kicks in. They get paid by Medicare. So they are under those guidelines. Okay? At this time, Reverend
Just wanted to
Shelton.
address- Just wanted to
I'm
address
sorry.
his question because he wasn't sure or clear as to, you were going to make a statement, is that correct? But you first want to know
Yeah, I just
about what I
wanted,
said about the
yeah,
federal
I
government.
just wanted to know if there was something that was preventing this.
No.
There's nothing federal guidelines that prevents this. This is still allowed. Okay.
Required.
Bill did do a visit to DeVita and the center over here, and we did get to see the patients that it serves, and it's amazing what technology has done recently and the equipment that they now have at those facilities to care for those patients. And that stuff's not cheap. That is very expensive stuff. The one unfortunate side of this is Medicaid and Medicare reimbursements. Now, I don't know what Fresenius's bottom line is, if they're a multi-million-dollar company or what is happening, but
45,000 employees.
45,000 employees.
Yeah.
But I don't know what
It's on their
the,
website.
I don't know what the,
It's pretty big.
the margins are at a center like that in Muskegon. So I don't know if $70,000 is a lot or not to them. But what I do know is Medicaid and Medicare reimbursement rates are very poor. That the amount that doctors and providers receive for actually treating patients is many times below the cost of doing so. So there are concerns just with that structural system of reimbursement, and that's one of the issues we're working on in Congress, to find a better system that we can treat patients better and that they do have the funding that they need to receive those treatments. And that's all a part of the healthcare and the continuous debate of healthcare. But we have seen those faces. We have visited those facilities, and it's a lot of issues going into this. So that's kind of all I wanted to touch
But
base
Senator
on.
Heisinger did kind of allude to on a national level, on a federal level, and that would involve our Congressman Heisinger. And we'd like that message there. We'd like to hear more about what he can and what he will
his
do
position?
on this issue. Is it possible that we can hear from him on what's been discussed? You were
Sure.
part of our meeting, about 5-6 months ago, and we shared some things. I know you were a little late, and we'd gone through most of the meeting at that time, but as I said before, this is a bipartisan issue, and Congressman Heisinger is our go-to person in Congress. And at this time, I do, and I thank you so much, but we do want to hear from our senator. I have contacted Lisa Boss a number of times, and
Lisa hasn't been in our office since April or so.
yeah, I sent the emails to her, and that's when I spoke to you.
She hasn't worked with us.
I understand,
Okay.
I understand. But
Who's the person that replaces her?
Peter
Who's the
Stayhauer.
contact person?
Peter Stayhauer
He's
is
the-
our DC person
You
that
you have
handles
that information,
healthcare.
Madam Chair?
I do, Mr. President.
So then, are you saying to us, are you suggesting to us that Peter Howard is the person that should be contacted instead of?
Instead of Lisa,
Yes.
yes. And we are.
But you can carry it.
Yeah, I am happy to carry back the message that
We'd like to
we've
hear
talked
from
about.
you. Our president, I think we sent you information, and you have the Muskegon branch email address, and on the letterhead we have the address there. So we would like to hear from our congressman on this issue at this point. Okay.